Good evening, everyone. Good evening. So, I'm your host, Sudeep, career designer. So, this is the show. So, from the classroom to boardroom, and episode number 32. As you all know, that we are gathered here to enlighten you about the different ways how the transition can be happen from classroom to boardroom. There will be the lot of challenges may come, and how we can overcome that particular challenges and hurdles and move forward in our career journey. Here we are inviting every moment all the distinguished personality, and today also we have invited one of the great personality who has more than 4 decades of the industry experience, and that is specifically in the pharma industry. And he is a global speaker, international life coach, mentor, corporate trainer, an educator, thought leaders, and also he has handled the domestic and the multinationals business for the Cadlia Pharmaceuticals, an Indian multinational leading pharmaceutical company based out of Ahmedabad, as a senior vice president, sales and marketing. He was recognized as the Rajput of Cadila within the healthcare fraternity, and this legacy continues. On top of that, he is an author as well. So let me welcome Dr. P.K. Rajput with thunderous round of applause, and let's hear from him. And today we will discuss about, is pharmaceutical industry a good career path? So, sir, welcome to this particular talk show. And if you can briefly introduce yourself, so that will be really helpful.
Thank you. A very good evening to all the wonderful viewers. I am, in fact, honored and blessed to be a part of Sudeep sir's show, right? Who is actually a career designer. Last time I met him, I was very much impressed the way he takes care of the thing. I'm also equally impressed with the book which he has written, the career, the chart, how you're going to take care of your charge, right, of your career. So this book is available in Amazon. He has presented me a book. So I was very happy. And thank you, Sudeep sir, for inviting me on your talk show, on the 32nd talk show. About me, sir, when we met, I just spoke to you also that I started my journey from a very base level, where you call it a medical representative level. And with the same organization, I have grown from the multiple layers. And my last assignment was as a senior vice president, taking care of 25 countries for sales and marketing. Earlier, I was the in charge for domestic business for entire India and Nepal, in charge for multiple divisions as a vertical head senior vice president. So this was my wonderful journey, and in this journey, we have launched multiple divisions, multiple products, built lot many leaders in the industry who are becoming the entrepreneurs also, and who are heading one of the good companies, and they are on the top position of the good companies as well. So this is my small journey, but at the same time, the learning was one of the very important part of the life. I entered this profession while liking this profession. Right, I was in the engineering college. I didn't like engineering. I joined this profession after leaving engineering college in just 45 days of time, without knowing any anatomy, physiology, biology, and all. But my passion has driven me to this level. All right, and then after that, I completed my MBA, then specialized course from IIM Ahmedabad. Then after that, this year only I completed my PhD. I also did some 27 certification courses. I have also become a member of Leadership Excellence of Harvard Square. So all these things are there, and the journey keeps on continuing. So learning, unlearning, relearning, and giving back to the society. This is the small thing which I can say.
Thank you, sir. Thank you, sir. Your brief introductions. I have almost this is my 32 episode, 31 episode I have already completed, and I have spoken with the almost the 31 different kind of the people, coaches, mentors, as well as the industry stalwarts. One common thing I would understand from each everyone mouth that the you have to be a learner throughout your life. You should not forget that particular things. That is the one thing. And the second thing is that you have to be a selfless giver. When you start giving and creating value for the society, so society will definitely take care of you. So
Correct, sir.
that is
Correct,
the
correct, 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 sir.
so sir, before moving into the discussion, so I want to know exactly. It's not from my end exactly. It's from the audience side. So if you can briefly explain about your journey, what are the challenges and hurdles came into your life during your career journey? Because you told you started your journey as a medical representative and reached to that particular level in the topmost, utmost, say that senior vice president in the organization level. It's not a matter of joke. And how you have reached to that particular level, definitely there will be the lot of challenges, lot of hurdles, and you have overcome that particular situation. And if you can explain to the audience, so it will be really helpful for them. It's a motivation for them so that they can also overcome that particular challenge and move forward. They should not stop their career in that particular path.
Right, sir. Sudeep, sir, very, you can say, very brilliant question you have asked, right? And it always give me a lot of energy to explain. I always feel that the challenges comes with the opportunity. It is like that the lock comes with the key. You have to put the right key so that you can open the lock, right? So I have already accepted the challenges as an opportunity. The first challenge which I accept when I changed my engineering college background part towards joining the medical profession. So that was my first challenge which I have accepted it. I knew it that I don't know how many bones were there at that time in the body. 206, we only know few of the bones which we can see. But after that, I have learned anatomy, physiology, right, and all these things, pharmacology, everything I learned about it. So I said, fine, this is a challenge to learn, right? This is an opportunity to learn. Right. The second challenge was that how to sell the medicine because I have not sold the medicine. So how you can become a good salesperson, right? So that also it has given me an opportunity how to talk, how to communicate, how to make the things happen, how to face rejection, how to face rejection, right? And how to come out with that happily so that next time the rejection should not happen because in any sales and marketing career, rejection is a part and parcel of the life. And if you are able to take it as a challenge, I think you will be start thinking the always and out of box because that rejection will take you toward the passion side, and the passion is going to help you to build the toward the positive side. So this was the second challenge which was there, that how to ensure and how to talk with the doctors for selling the medicines when I was on the very naive state. Then after that, the other challenge was that we have to start working here, there, going on the buses, going on the trucks and all, because at that time commuting was very, very, very impossible part. But again, the challenge was that how to ensure the things, and the opportunity was there are things are available, right? So let us utilize, let us learn from the hard way. So if you learn from the hard way, you will enjoy the best way. Whatever the things life gives you after that, then you will remember, oh my God, I have traveled in the truck, in the lorry, which was full of the stone because in the night time there was no commuting thing was there, and you have to travel for 100 kilometers, right? So these are the good things are there. Oh, that is also the life. These are the challenges are there. Then when I got promotion, right, in UP, I was based at Gorakhpur. I got promotion in Agra. Then I got promotion in Lucknow. So my in my mind, one thing was very clear, that how to accelerate, right? How to utilize the opportunity, right? How to learn from the opportunity, not utilize, learn from the opportunity, so that should become a milestone for me for my future, and so on. Then another challenge had come when I was promoted as a zonal head for entire South. The challenge was we never used to know how many languages were there and all. But one thing was there in the mind, the zeal was there in the mind that yes, after all, people are same, medicines are same, right? Body is same, diagnosis of the drugs will be same, right? So let us go and learn from them, because when you go to the different areas, You'll be able to learn the culture, the manners, the etiquette, the behavior, the knowledge, right? So I said, okay, accept it. And then again, I went there. The next promotion I was in Bombay. People they say Bombay is always on the toes. I said, wow, another opportunity to be on the toes. Right. So let us learn how the Bombay life is. So Bombay life never allows you to sleep. Right. So then this is very good. When one city, when I was covering the entire India at that time, so it never allows to sleep. So wow, that is the right stage. At the age of 35 years, of the age of 35 to 40, if I am not being allowed to sleep and I would like to see how to fulfill the dream, what is the great opportunity it is like that, and it is going to work for me for coming 20 years of the time. So I took that important opportunity, not challenge, opportunity. Right. Then after that, when I came to Ahmedabad, then I have to deal with my seniors, with my colleagues. A lot of the ego things were there, right? Because seniors are seniors. So then I learned how to adjust yourself, how to start responding on self instead of reacting on the things. So if you start responding, people will love you. If you start reacting, people will reject you. So I don't want my rejection. I want my response. I want my love. I want my affection. I want my coordination. So this is the other thing which I learned. Then I said, and from the head office, if you have to see with the bird's eye view, so how to deal it, so how to have the compassionate part, compassion, gratitude. That again I learned from that. That if you put the things on the today, people they talk of the post-COVID gratitude, compassion. But I learned 20 years back when I came to Ahmedabad that how compassion, humility, humanity makes a difference. After all, humans are humans, right? And if you touch their heart, right, they will work for you. And sales line is a very emotional line, right? So you have to have a strategy, you have to have the knowledge, and you have to ensure the work from the people. So if you touch the heart of the people, they are for you, right? And the leaders is always the leader who ensure that the people should start leading instead of he should lead. Right. You are leading, of course, you are guiding. So you should become a mentor of the people and build your team in such a way that if you are not there today, the people should start marching ahead. Nobody feel that you are not there, but they should be working on the guidelines which you have given because they enjoy that. They don't want to see back. They want to see ahead, ahead, ahead. So this was the thing, and then after that, another challenges was had come in terms of the opportunity that when they have given me different segment of the divisions to start launching on the different. Okay, wow, I'll be able to launch multiple brand, multiple divisions, multiple products. So it is again learning because I was confined toward the 3-4 segment, but in my entire arena of this working part, I launched a neuro products also. I launched a gynec division. I launched a gastro division. I launched a orthopedic division. Right. So you talk about the general practitioner division. I launched a oncology division. I've launched a nephrology division. So you, when you start launching so many divisions, we can see from head to toe. Like they start from the neuro here, then you go for the cardio here, from the heart. When you go to a gastro now, so you understand the thing that how the behavior is. So it is opportunity. Tell me, there's no challenge. So and then after that, when they have given me an opportunity for international market, I'm go, wow, let me see people. They say, oh, international people, they don't understand the language. There is 6 hour differences there. How you will go, wow, this is good, no? Because I know that I have to work for 24/7. And since the time I'm in the part of the working part, it is always good because they are also human. They also eat the food, that same thing what we eat. The only thing is the culture is different. They also have the heart, they also have the brain. So let us work on their mindset. So we started working on the mindset on the. So again, the opportunity was there. We were succeeding. The team was very good, building the team. So this is the way we had utilized as an opportunity and enjoyed that. And the success used to come because it was the team who used to work, right? So lot of appreciation, lot of celebration used to happen. So this is all. So I have never taken any hurdles as a hurdles. I've always taken it as an opportunity to come out. Because when you see the opportunity to come out, it is like a ray of hope from the dark tunnel. Right? You know that when the tunnel will be over, you are going to have a complete big sunshine. So let us pass this tunnel with that ray of light and you can see the sunshine. So this was the only thing which is there in my mind and still it is continuing. Right? And it will continue with the grace of God, with the blessings of the God.
Great, sir. Great journey, sir. Yeah. So, yeah, it's might be really helpful for the people, those who are listening to us. So definitely, so you think about the challenges, hurdles. Don't think that is a challenge or hurdles. Think about that would be the opportunity. So yeah, so that's a really great lesson. Everyone should learn from him. Yeah. So next we should move forward to the next level of the discussions. As we told that, so we'll talk about the pharmaceutical industry, whether is it a better career path for anyone else or not. We'll be moving into that particular directions. So, sir, just I want to know. So, there is the so many industries are there in the market. Okay. So, is there any specific reason? So, do you think that the people should choose the pharmaceutical industry, or what is your opinion in that aspects? If you
Sir,
can give something,
sure,
yeah.
very a good question. The thing is, the people who are on the sales, see, pharma industry, people who are basically from the D pharma, B pharma, BSc or MBA, they're choosing it because it is a result-oriented profession, right?
Mm-hmm.
The three things I like to highlight it here. The people who start the career with the plain BSc or B pharma, right? I'm talking the
Mm-hmm.
base level. They
Mm-hmm.
are meeting with the most qualified person of this entire society. The most qualified person is doctor, correct?
Correct.
So when you are meeting to the most qualified person, right, and you are talking something of the human science, right, because you are working for the organization where you are going to elevate the human suffering with the brand which you are selling, right, of your company, which makes a lot of difference, right? So you get a lot of satisfaction. See, everywhere you have to do the hard work. You cannot escape from the hard work, right? That is the essential requirement. But when you
Correct.
start doing the hard work, right, the results start coming up, right?
Correct.
And this is the only one
Correct.
industry, sir, where lot many people, right, today they have the top companies, right, because the Cadila, Zydus, DRL, right, and you can say the Cipla, right, and Torrent Pharma or Mankind Pharma. Every person has worked here. Sun Pharma, either as a pharmacist or as a basically a medical rep.
Yeah.
So this is the growth is there. This is the growth is there where you can make your career, and you can become an entrepreneur, and you can start giving life to many people, right? And it gives you a lot of learning because it shows you how to tackle the situation and how to be very happy in all the situations. I told you my journey about it. There are a lot like me. There are so many good people are there, so many intelligent people are there, so many hardworking people are there. They are the top leaders of the industry in the same pharma industry. So it is the total proportional to the thing. The hard work, the intelligent work, the passion, the compassionate work. If you do, it gives you the result. So whosoever is thinking to join the pharma industry, they must join. They should join. They should learn, right? And at the same time, they should make their roadmap that what the after 3 years, 5 years, 10 years of the time, what they want to become, and they'll keep on learning about the thing, keep on learning the strategy, keep on learning the technology because it is going to help. And this is the only one industry, sir, I can tell you. Whatever you will sow, you are going to reap the things. I have seen that thing. If you sow a seed of a mango fruit, definitely you are going to get a mangroves. Then the one of the great thing is there because a person like me then did only simple BSc, leaving engineering college, reached to this level, right? So this is one of the example, and there are many examples are there. I've told you the example of the industries. So the people whosoever is thinking, the young minds, yes, you should join, but accept the failure as an opportunity for the next step, right? Because every time you cannot become successful, you
Correct.
have to have the
Correct.
failure, right? Because I
Correct.
always remind, in the sports, when the two teams plays, it is evident that one team will with the winner and the second team will be the loser. It doesn't
Correct.
mean the second time when they become the loser they don't play. They play with the same zeal, just right, and the people they cheer them up. So everybody, your family member will cheer you, everybody will cheer you. It is not that the final is the result of the failure. No, Thomas Alva Edison won 10,000 times, but he said that he got the experience.
Exactly. Absolutely, sir. Yeah, as you told exactly. So failure is the stepping stone of the success, basically. So you should think about the why you have failed, and you should do some analysis. And the next time when take some actions. You should not fail in that particular steps. Maybe you can fail in the next steps, but you should not fail. And you should reinvent the wheel basically every time if required. And another thing, so another code exactly came in my mind, so I thought of tell you. So you told about the always the opportunity, so don't think about the hurdles or challenges. Yeah, hard. So the quote is nothing but like that: the hard times create a strong people create good times, and the good times create the weak people create hard times.
Correct, sir. Correct, correct. Very correct, very correct.
Yeah. So let us move into the discussion exactly. So yeah, so you are been to the pharma industry for the quite long time, sir. So I just want to know. So where do you want to see this pharma industry next 10 years?
Sir, we are already the pharmacy of the world. We can proudly say, being an Indian, every Indian should say that they are the proud owner of the pharmacy of the world. In the coming 10 years of that time, we are going to rule the world in terms of providing the things. 40% of the generic medicine has been provided by Indian pharma company to the world. So the vaccine, you know that our scientists are so wonderful. In 6 months of time, they are able to provide the vaccine to the many part of the world. So you can understand the knowledge, the capabilities, the R&D, the research which is happening there. Pharma industry is going to take over. It is going to take over the China because now people are not getting dependent on China. While we are capable enough to provide the medicine, the generic medicines and all, and we are the quality is very very good. At the same time, sir, here the labor cost is very economical as compared to the US market and the European market, right? If you go and purchase the medicine there in the international market, because I know I've sold it on the different markets, right? The cost is enormous, huge, right? But in India, it is very very economical. So the people they come there, they transfer the things. So India and our pharma industry is going to rule, sir, in the coming 10 years of time. Either it is of the basic drugs, generic drugs, and also in the biotechnology, also in the genomics, right? So you talk about the biosimilars, everything is coming up, sir, and it is going to make a difference. The only one thing is that we have to work more on toward the R&D part because the cost of the R&D is very very high. So some of the big giants multinational they are working on the R&D, right? So I am not ignoring them, but at the same time, other part we are self sufficient to make the difference, and we are going to be the top 10. So in 10 years of time, the number one industry.
Great, great. Yeah. So those who want to build your career in pharma industry, I would say the next 10 years will be the glorious year for you. You can jump into the pharma industry. As Sir told, so degree doesn't matter exactly, even though you are BSc
BSc,
or
BSc,
maybe
sir,
the
sir,
BSc is more
BSc,
than enough
D
exactly
Pharma,
to get. Yeah.
BSc, D Pharma, B Pharma, right? So
Mm-hmm.
think that you have to build your career, right? Jump on that and work
Correct.
judiciously. Don't compromise, sir. This is one thing is there. Never ever compromise on your work. Whatever the thing which you are doing, it never ever compromise.
Correct.
And results are going to come. Results are bound
Correct.
to
Correct.
come.
If you start creating the value of the value to the companies, the vision and mission level, so definitely company will think about you. So all this position and all, it's nothing negligible. So I'm just moving into the next discussion, where just I want to know. So, sir, just in the current market scenario of the pharma industry, what kind of the salary? So if someone is ready to join to the pharma industry as a fresher, he or she doesn't have any kind of the experience. So based on your experience and all, so what kind of the salary they can expect?
Sir, three things are there in the salary. One is the basic salary which they get, which we call as the CTC, right?
Mm-hmm.
It will start from the company to company level. It start from 3 lakhs, 2.5, 3 lakh rupees to 3.5 lakh rupees. And if they
Okay.
are working in a niche segment, right, it may go to 4 lakh initial, right? Then
Okay.
we have the daily allowances also. Right.
Okay.
Daily allowances is basically for the person who is working on the local allowances, ex-headquarter allowances, and outstation. So basically, it is a local and ex-headquarter allowances are there. Why the allowances has been given to the people? Because it is equal to their petrol expenses or something that there. So the salary is a different part, allowances is a different part. Then, sir,
Mm-hmm.
there is a incentive is there, right? And this is only one industry which gives you the incentive on achieving 100% of your target, right? And target is one thing which you have to put your effort, right? Little more effort. So why? Because we understand na, that in our when we were in the school and the college, the person who was the student who was very laborious in terms of knowledge, he or she used to get the first position, right? That was an extra effort. It was there. Where the teacher was same, books are same, right? Everything was same, right? So in this area, if you are able to do the effort, right effort, implementing the company's strategy, you are going to get the incentive also. The incentive is very very huge amount of the incentive which you get it. So you have three things. You have the salary which will start from 2.5 to 3 lakh rupees, it goes to 4.5. The daily allowances are there, and then after that, the after completion of your probation period, you are eligible for the incentive also. Incentive, it depends that it may go to 3,000 to 5,000 to 10,000 rupees per month as well.
Oh, great. Yep.
Yes,
Yep. So, and in the pharmaceutical industry, so there is the more or less, because I know one of my friend, his wife is working in the, I forget about the company's name. So one of the prestigious, the multinational company, the R&D department. So, what kind of the life, if what kind of the degree, or what kind of the salary, the people, those who have that kind of the expertise, the R&D or the quality control and the assurance in that particular, is there any kind of the segregation of the salary part? Do
yes,
you
yes,
think?
yes, yes, yes. Sir, now when you are in the sales and marketing, so I will
Mm-hmm.
again put it in the three ways, right? Three or four ways. When you are the sales and marketing, you are the money spinner for the organization because
Mm-hmm.
you are the person for the loss and profit, correct?
Correct,
Because
correct.
anything and
Yeah,
everything happens in the sales. If you have the sales and the money comes back, then you are a gainer, correct? So this is a
absolutely.
separate part of it, right?
Correct.
And other people which are from the R&D or in the production department and all, they are also important. They are equally important. But it is a long-term process, sir. It is a long-term process because in R&D, when you are doing it, some molecules, something like that, and at the same
Mm-hmm.
time, when you are the part of quality control, you have to see that the right drug has to be given because there is no compromise on the quality. All these things are there, but their growth is also there. But their growth is little slow as compared to the people on the sales and marketing because sales and marketing immediately you can see the result. Target achieved, you are well. 1 month, 2 month, 3 month.
Got
Because in the entire year, 12 times you can achieve your target. So you can show your result card 12 times in a year.
it. Got it.
Right, but
Absolutely.
in
Correct.
yeah, but on the other side, the result card is there. It is not that without that time, but it will be little slow about it. When you have the quality control, again the things are there. So it is a process, and there they require a the little more learned people, M Pharma, M Tech, right, PhD,
Mm-hmm.
because they are
Okay.
dealing with the completely brainy things and the science. They are in the office,
Mm-hmm.
so they only think that what is the new therapy, how the things are happening. So they are more confined to the lab, the technology, and other things are there, right? So they
Mm-hmm.
come from the home, they go to the lab, they go to their office, finish the work, and then they go back. But here in the sales line, you have to run, go here, there, whatever the things are there. So of course, it is the two different stories are there. Then the people who have done their B Pharma and all, they want to come in after doing the MBA, they want to come in HR job, right? HR job is again a very lucrative job, right? Where you can understand the people, you can make the things. So there again, MBA HR is required, right? After doing your B Pharma, BSc and all, you can do MBA HR and you can make your career toward the HR side, right? Then after that, you can also become a training person. So training person, you have to have the experience of 5 years, 10 years of time, good product knowledge, because a training person should be like a master of the things, and whatever the thing has been given, he or she can be able to elaborate the people. So there are the multiple channel things are there which I'll be able to tell you if you are going to ask that what are the different ways are there, but that is the
Mm-hmm.
difference in that.
Okay.
And here the
Okay.
growth is very high. In the sales and marketing, the growth is absolutely very high. The ladders are there in front
Yeah.
of you. It depends how
Correct.
fast you are going to step up.
Correct. So each and every company exactly. So I have seen in my career the last 2 decades. Yeah, sales and marketing people, they're the leading the companies basically. I would say because as you told, so companies, the profit and loss, everything is the sales and marketing only. If there is no sales, no revenue, so company, even though there is no, for my case exactly in the IT industry, if there is no project, so the who will be, what he will deliver the things. So it's a bread and butter, I would say. The sales is the backbone of the business, I would say. Yeah. So you already explained about the different kind of the job of the pharmaceutical industry. Yeah,
So
and
apart
what
from
can
this,
we do?
I will like to also add, there's a, you can
Yeah.
become an entrepreneur also. You can become
Okay.
a pharma consulting person also. A person, he
Mhm.
after doing your B pharma, the person can be the hospital pharmacy, clinical pharmacy management. Pharma, the person can go to the production line. Pharma person can go to the chain management, supply chain management, sir. Pharmaceutical person can also go toward the pharmacovigilance management. In the government
Oh.
job, a person can go, sir, and a person can go in the research segment also. Sir, today we are talking about the AI, artificial intelligence. So the data management and analytics can be added by the pharma person. A pharma person can be a part of the big hospital where the data has been managed. Where we are talking about the AR, VR, like augmented reality, virtual reality. So there are lot many things a person which is basically there. There is a wide scope is there for a pharmaceutical person who can make his or her career in the various ways. Even the government is also encouraging now, and right, and they are having. You can become a drug inspector also after doing a B Pharma after completing the exams. Earlier, gone are the days when there will be a drug inspector once in the five districts. Today, in every city, there are two drug inspectors are there, right, to ensure that no spurious drug has to be taken care. So you can make your career in the international marketing also, right? After doing your BSc, B Pharma, working for a company for 8 years, 10 years of the time, when you're on the position of manager, you can become a country manager, right? And then
Mhm.
you can start taking care for one country as a head of the country manager. So there's an enormous scope is there, sir, in that way.
Great, great. Yeah. So yeah, so I just in a nutshell, so I want to say exactly those who are listening to us. So I would say if you have any particular query related to the pharma industry, you can put your message here in the chat box, so we can clarify your query. And otherwise, if you don't have any query or anything, if you want to reach out to the Rajput sir, so you can reach out to him directly. He is available in LinkedIn, and you can directly put your question there itself. Or otherwise, if you don't know directly to him, so you can reach out to me. I can pass your questions to him, and he can clarify your query. So that way we can solve your issue and solve your query. So next, moving into this, before concluding this particular session, so we have discussed almost more than a half an hour. So yeah, so I want to conclude this particular show. But before concluding this show, I want to know just one thing. So what key message you want to pass it to the audience, sir? So that they can do something in their career, if they want to choose the career path as a pharmaceutical, or irrespective of the any industry, if they want to choose their career path. Yeah.
Sir, I think again, second very important and brilliant question which you asked, and that's why I can resonate your debate. Take charge of your career with the book which you have launched in Amazon. It is very
Yeah.
important. You are the in charge of your career. You means as a person, right? So whatever the career you are choosing for yourself, you should be very clear about it, right? You should not becoming a doldrum on the career, right? And once you are choosing the career, you go all out to ensure that how you are going to be successful in that, because that is your choice. Nobody is compelled you to choose that career. You have a good IQ. You understand the things. You understand the nuances of the career. So and we have worked also, means you have learned in your graduation days and all. And today in the technology world, everybody is there with the Google, Dr. Google. So everybody can see that what the things are happening there, what are the good things are there. Never see the negative side of the thing. Think what positive can be happen, right? People they say that I cannot become Sundar Pichai. I say why you cannot become Sundar Pichai? If not Sundar Pichai, next to Sundar Pichai. People they say
Exactly.
I cannot become the APJ Abdul Kalam sir. No problem. You can be next to the APJ Abdul Kalam sir. Right. It is a very humble people, simple people who have grown from their life. They are not born with a golden spoon in their life, but they have
Correct.
worked. They were passionate enough. They were obsessed enough to make the things happen. So work for the things, think on your goal, prepare a roadmap for yourself, make a roadmap for your goals, start working on this. And it is not that every time you'll get success. Don't get demoralized with the becoming a failure. Think that you have not attempted it rightly. That is the reason that failure has come. So if you attempt in a different way, the failure will be converted toward the success part, and it is going to happen, right? So start working on that, concentrated, and don't get demoralized with the people saying. Do what you want to do it because you understand your goal. Keep your ears closed like a deaf person, but eyes open like an Arjun eye. Because Arjun eye always says that your goal is the eyes of the bird, not the trees, not the bird. So that is your career, which is there, which I want to say. And because if you will be successful, who will be the most happiest person in the entire universe? You, and then your family, because they will be the most successful people, will be the happiest people that you are making them to shine in their entire community. So enjoy yourself, never compromise, never compare, right? And never have the losing your confidence. Have the self confidence that feel that yes, I can do it. I will do it. I'll ensure it. So these are the things are there. Very simple. I'm not talking about the rocket science. I'm just simple talking about a mindset to ensure towards the success. And believe you me, it is say na, first battles are won in the mind, then the battles are won in the field. So you have to win the success of your career in this mind, beautiful mind which God has given, right? And which is God has not given to anybody. And that's why we are the most fortunate people, persons in this entire beautiful universe. That is all I can say, sir.
Thank you, sir, for your time. So sharing the stage with you and giving me the opportunity to asking you the few questions about the pharma industry, which will be helping for the society. Those who are really struggling in their career, or might be they want to build their career in the pharma industry, giving the great insight to them, and it will be really helpful for them. Thank you, sir. We are
Thank you.
ending this broadcast now itself.